Deductibles, they are important. They have a big impact on your healthcare cost and your plan cost and your wallet for that matter. But what do they do again, and why are they important, and why are they maybe good or maybe not? This is Michael's Medicare, where we talk about all things Medicare, from plans to benefits to enrollment periods, extra help, prescription drug coverage, Medigap, and the whole kit and caboodle that is Medicare. But before we get to it, please don't forget to like and subscribe, because it does really help our channel to grow, but also because it'll keep you up to date about the newest Medicare changes, the newest Medicare options, and ways to make more, better informed Medicare decisions. All right, here we go. So let's talk about a deductible, about what it is and why it is actually okay, and then how it applies to things like original Medicare, Medicare Supplements, Medigaps, Medicare Advantages, and prescription drug plans, because they all do have some sort of deductible in one shape or another, but they don't apply them all exactly the same. First, a deductible. So if we ask Medicare.gov what is a deductible, it will say a deductible is, quote unquote, an amount you have to pay for covered services and items each year before Medicare or your plan starts to pay. And that is correct. And really, who am I to argue with Medicare.gov? But deductibles are not unique to Medicare. If you have car insurance, you will likely have a deductible. If you have house or renter's insurance, you will likely have a deductible. If you have boat insurance, you probably have a deductible. It is just that initial amount of money that a person is responsible to pay at 100% prior to the insurance kicking in and paying for some or maybe even all the rest of those costs. An example of this would be if you have car insurance and the deductible is $500 and you get into a fender bender, then you're going to be responsible for that first $500 at 100%, and then after that the insurance company will help to pay for the cost after that. So that is a pretty easy thing to understand, but also it's important to understand that the deductible does play a very important role, especially in healthcare, in actually keeping the cost of a plan lower. Now, I know deductibles always play the role of the Wicked Witch of the West in the Disney Medicare movies, if there is such a thing, but the reality is that they are there to help keep the cost of care down. Whether it is through original Medicare, Part A, Part B, Part C, Part D, or Medigap, they are there to help keep costs from rising too fast. And they are there to stand as a reasonable barrier to prevent people from just going and using care kind of willy-nilly whenever they want, without limits. Yes, there is, of course, a discussion about what is reasonable and what is an appropriate limitation on care, but not for this video. All right, so enough of that. But love them or hate them, deductibles are a part of the Medicare healthcare mechanisms, and they are built in different ways depending on which part of Medicare somebody is trying to utilize. So let's talk about how the deductible works under just plain old original Medicare. Original Medicare is made up of two parts: Medicare Part A and Medicare Part B. And this is what folks usually will enroll into right when they turn 65, except for, of course, in certain circumstances. And if you want to know about what are some of those certain circumstances are, we did do a video a few videos back. Check it out. We'll help you figure out maybe whether you should decide to enroll or not. But original Medicare is divided into two parts: Medicare Part A, which covers things like hospitalization, major surgeries, and things like that. And for a vast majority of Americans, Medicare Part A does not have a cost to it, because while they were working, they paid into the Medicare payroll tax, which very noticeably gets removed from our paychecks every pay period while we're working. As a result, there is no monthly premium for those who paid into the payroll tax when they enroll into Medicare Part A. Part B, on the other hand, covers things like day-to-day care, maybe lab work or doctor's visits, specialists, x-rays, physical therapy, and all those kind of day-to-day usage. And it does have a monthly premium that has to be paid of $174.70 in 2024. And again, that's going to get paid regardless of how long somebody has worked. Also, it changes every year, and by changes I mean it goes up. Now, each part, A and B, has a deductible associated with it. For Medicare Part A, there is a per benefit period deductible that has to be paid when someone starts to be admitted to a hospital. If we pull a quote right from the Medicare User Manual, that is the 2024 Medicare and You Handbook, it says a benefit period begins the day that you are admitted into an inpatient or skilled nursing facility, and the benefit period ends when you haven't gotten any inpatient hospital care or skilled care in the nursing facility for 60 days in a row. What this means is that after 60 days, if you don't go back into the hospital or skilled nursing facility once you're out, then if you do go back again, that benefit period once again starts over again, which means in the unluckiest of situations, a person could have 6 benefit periods, or rather 6 Medicare Part A deductibles to pay in a single year. Why this is important is because for Medicare Part A, for each benefit period, there is what is called a Medicare Part A deductible of $1,632. And that covers the cost for the first 60 days that somebody spends in the hospital. For subsequent days, there are daily costs per day up to a maximum number of days in a totality of a lifetime. Again, in those unlucky situations, that could mean that somebody could potentially have to pay $1,632 each time they go out and go back into the hospital for a maximum of 6 times throughout the year, which is $9,792 a year. So that's a lot. So that is Medicare Part A deductible, and there are ways to get help to pay for some or maybe even all of that cost with Medicare Supplements or Medicare Advantage plans or even Medicaid, but that is just on its own, and it can make, a reality of a year very expensive if you have lots of healthcare needs. Now let's talk about how the deductible works for just regular old Medicare Part B, or the other half, perhaps even the better half, at least the more often used half of original Medicare, because Medicare Part B covers things like doctor's visits, specialist visits, lab work, x-rays, day-to-day care. But it has a deductible that is a bit more manageable because it is a yearly deductible. How the deductible works on a Medicare Part B plan is that there is a once a year, an annual deductible of $240 in 2024. Again, it does change year to year. This is in addition to that $174.70 premium that has to be paid monthly. This $240 deductible is paid by the beneficiary when they use any of the Medicare Part B services. And once they hit that $240, then for the rest of the year, for the Medicare Part B covered services, Medicare will split the cost with them percentage-wise. So Medicare will pay 80% of the cost, generally, and the beneficiary will have to pay a remaining 20% of that cost, generally. But just one little tiny thing to mention is that actually quite important is that there is no limit to that 20%, which means, yeah, paying 20% of a bill is not too bad. It's just like sort of leaving a tip at a restaurant. But the thing is, there is no limit to how much that bill can be. So if your cost for healthcare in the year is the same as the cost for a steak and a salad, and it's $100, that 20%, not too bad, $20, right? But if you have $10,000, $20,000, $30,000 of usage for Medicare Part B during that year, then 20% can get real painful real quick. And like Medicare Part A, there are ways to help mitigate some of those costs, or at least help getting paid for that 20% through Medicare Supplements. But again, we're gonna save that totality for the next video in this series. All right, so I originally had planned to do one like big, giant, hairy video talking about all the Medicare deductibles together for Part A and Part B and Part C and Part D and Medicare drug plans and Medigap. But it seems like it just it was going to be too long and it wouldn't fit into this video. I mean, even the squirrels are starting to get tired of hearing about Medicare out here. So I think what I'm going to do is save the Medicare Advantage, the Medicare Part D, and the Med Supp deductibles for the next video next week, right after this one. So tune in to the same Medicare time at the same Medicare channel, and we'll get those ones done next week. So with that, if you do have any questions about Medicare deductibles from either Medicare Part A or Medicare Part B or Med Supp or Medigap or Medicare Advantage or Medicare prescription drug plans, or really any questions about your Medicare, or you want to take a look at Medicare health plans, please feel free to reach out to us at the information down below, or you can just check out our other great Medicare content on Instagram and on YouTube. We have new Medicare content coming out every single week. So with that, I'm Michael, and this is Michael's Medicare, hoping that you have a great rest of your day, and goodbye.